And we're live. Outstanding. All right, I'm going to go ahead and get our guest connected. And I've hit the invite for our guest. Folks joining us, just be patient with us for a few minutes while we get all the...
Hi.
Hi. Very nice. There you are.
Perfect.
So for everybody who's joining, we'll take 2 minutes for everybody to join. And then we'll do some housekeeping and do some introductions. And we'll start with the program. Very nice. You look great today, Alyssa.
Thank you. So Mom log on. Hi, Mom.
All right. I could see folks joining, hearts going up, people waving. Fantastic. Folks, we'll give maybe another 2 minutes and then we'll start the program.
Sounds good.
Yana, very nice.
Lots of people logging on.
Absolutely. For those folks just logging on now, we're going to give everybody just a couple of minutes and to get on the program, and then we'll kick off after that. How's the weather up there in Chicago? Pretty cold?
You know, it's not great. I pulled out the full winter parka this morning for the first time this season. So, you know, we'll see. But I'm used to it. I grew up in the Midwest. This is my normal. So got some snow going the past days, but accumulating. But it's all in the spirit, you know, of our giveaway that we'll talk about later too. So.
Oh, fantastic. That's great. Great. So for everybody, let y'all know, make sure you stay to the end because there's going to be a giveaway at the very end of the program today. And I'm going to reserve all information until then, until I don't want to give any, any reveal before then. Just chat bar, see if there's anything. Okay, looking good there. All right. We'll wait 1 more minute and then we'll go ahead and start. People still logged on, which is good. All right, got 10:03, almost 10:04. We'll go ahead and get started. So we have to do some housekeeping first. So before our introductions, and housekeeping includes really to let everybody know that the medical information that we'll be talking about today and all the information that we're going to be discussing is considered to be direct medical advice. And want you to know that this program does not constitute or establish any kind of patient-provider contract or agreement. And that what we want you to do is take this information, make some notes, and take this back to your healthcare provider, and then you can discuss this with the healthcare provider before you make any type of changes to your own healthcare. And with that said, I want to go ahead and introduce our guest. But before I do that, I want to introduce myself. My name is Scott Duhaime. I'm a licensed PA. This is my second time hosting Allergy Insider, and which is exciting for me. I've been a PA for over 25 years now, and that time has been divided between the military as well as a faculty associate at the University of Texas Health Science Center, which is the medical school here in San Antonio, and at the Children's Hospital of San Antonio, and the Pediatric Ear, Nose, and Throat Institute. But since 2015, I've been part of the medical and scientific affairs team with Thermo Fisher Scientific, where I am one of the senior clinical educators. And with me today, we have Alyssa Bauder. And Alyssa, as you can see on the screen here, Alyssa's coming to us from Chicago, where she's broken her long coat out for the winter. And Alyssa is a blogger. She's a advocate. She's a spoken ambassador, and she's a research assistant with CFAR, which is the Center for Food Allergy and Asthma Research. And most importantly, Alyssa is the founder of All Things Allergies. Now, Alyssa's history includes she was actually diagnosed with multiple food allergies as a child. She had lots of food allergies, but today she only carries the clinical diagnosis of having peanut allergy. So what Alyssa's going to talk about, and we're going to talk about, is how she got from here to here and the gap in between that and all the history of what led to multiple food allergies and where she is today. We're also going to talk about the fact that Alyssa is taking all of that information from her history and where she is now. She's taken that into her graduate studies, and she's utilizing what she's going to on her multiple platforms and how she plans to go into the future and talking about being an advocate for and an educator of not only food allergies, but in the mental health space. And with that, welcome, Alyssa.
Thank you so much. I'm so excited to be here and kind of talk about my journey and how people like you and organizations like Allergy Insider are getting me to this brand new space. So thank you so much for having me.
Oh, absolutely. So I thought, and thank you for that. And I thought we would start off with, just tell our audience and tell everybody about what it was like and what led you to have all these diagnoses as a child. Tell us, how did this all start and what led up all these different being diagnosed to so many things when you were a kid?
Yeah, and I think that that's one of the most common questions I get asked when people say, curious about my food allergies, and always ask, like, when did you find out? How did you find out? And my story, I think, is probably pretty similar to a lot of other people on here, a lot of other families with food allergies. I have an older brother. He's 2 years older than me, and he was actually the first one to have a reaction in our family. He ate some sort of tree nut and ended up having to, go see an allergist to kind of figure out what was going on. And then once we figured out that he had allergies, I started to display maybe some similar picky eating behaviors that you see in little kids. And my parents are like, okay, we're sending her too. So that was kind of how we kind of first figured out that there was something to look into. But then as I got older, me and him were going into our allergist office, getting tests when we were young. And it's curious actually, because we have a lot of similar allergies. We both, when we were little, were diagnosed with peanuts, tree nuts. He was not allergic to seafood, but I was. But this was something that I started off with. I mean, I was very young, probably 3, by the time that we had this full long, I call it my laundry list of allergies.
Yeah. Wow. So break down that for us a little bit. So it was peanuts, some tree nuts, some fish, and what else were you allergic to?
Yeah, so I was doing finfish and shellfish. I was avoiding both, all peanuts, tree nuts, as well as legumes, avoiding chickpeas. We were avoiding lentils. And then there were some oral allergies that we also avoided. So raw apples, raw bananas, raw eggs, raw tomatoes. And so there was a lot of things that were just completely taken out of my diet. And I think after people ask me, how'd you find out about your allergies? The next question I always get is, what do you even eat? And that, I think, especially was my situation, especially as a little kid. So many things that were just kind of taken out of my diet and my whole family's diet, really, because my brother had very similar allergies, and that was just not stuff we kept in the home at all.
Wow. Well, that must have been that must have been a huge toll on you emotionally, physically, at school, etc. I mean, did you feel like you were, throughout your school years, did you find it to be a burden, or was it something that was kind of easily manageable, or where were you on that?
Yeah, and it wasn't really something I thought about until recently. I think especially as I've gotten more into this field and wanting to kind of direct my future career to kind of addressing some of these things, that I look back especially on myself in grade school and remembering, okay, I sat at the food allergy table by myself until I was in high school. And I had to, deal with the kids to me who would, try to put something in your lunch, like had nuts. And that was something that I've never known any different. I think that always just kind of felt like my normal. And now looking back on that, and I'm like, okay, that was not normal. And I was an anxious kid to start out with, but I had my first anaphylactic allergic reaction in first grade. And so again, that was pretty early too. I think I was either 6 or 7 at the time. So very early, and I don't really have much of life memories where I haven't have gone through anaphylaxis. So much of my life is kind of colored by having had that experience. And as somebody who was already anxious and then having this event in first grade that, you know, we'll dive into a little bit more, certainly changed the course of my life forever.
Yeah. Well, let me just ask you about that. I mean, I'm sure you have vivid memories of that anaphylactic reaction. I mean, did you have a lot of, you know, a lot of, I don't want to say PTSD, but you have a lot of memories from that that I'm sure affect you even probably to this day.
Yeah, and actually I would use PTSD. So at that point was not aware of that, but later on in my life, able to go in to see mental health therapists and providers who were more educated in this idea of food allergy anxiety, and reflecting back on that and saying, you know, this was a traumatic event for you. This is post-traumatic stress symptoms, and that you qualify for a diagnosis of PTSD. And so I don't want to shy away from that terminology, because I think that's completely what it was. But yeah, so it was a traumatic event, and that's what you have to meet a criteria for a diagnosis of PTSD is some sort of traumatic event. And you know, I'm studying psychology, so I've got the book at home, you know, the DSM, and I always refer to it that right there on the page, it says an example of a traumatic event is anaphylaxis. And I remember reading it for the first time, and I was like, nobody talking about this. It's written right here in the book. And so it completely, it completely fits. And so it was first grade, it was Valentine's Day, and you know, you're in first grade and you do the little shoe boxes and you decorate them. And it was supposed to be a really fun day. I loved school as a kid. And you know, you do the little Valentines in your class. And I remember there was 2 other boys in my class that also had food allergies. One had peanut allergies and one had milk allergies. So we were really close with my teacher. She was great. And so there was kind of that caution that I think, especially, you know, I'm 25 now, so over 20 years ago was not the same allergy protocols that they have in schools. But my teacher did really do a good job of trying to limit that. And so there wasn't supposed to be any sort of peanut products, you know, there on Valentine's Day, but I ended up taking my little Valentine's Day shoebox home. I remember I was playing some sort of video game on the computer, and the wrapper that I had, you know, I know what a Butterfinger looks like. By that age, I knew a Butterfinger was yellow. I knew that a Reese's came in like an orange color, but now everything in my box was pink, red, and colorful for Valentine's Day. And so, you know, I'm 7 years old. I'm like just learning how to read like full like paragraphs. And so I can't like read this tiny little font on the back and know that that's a Butterfinger. And so I bit right into it. And I knew I had never experienced anaphylaxis before, but I knew in that moment something was very wrong. I hated the flavor. People always ask, they're like, well, do you want to eat peanut butter? I'm like, no, I've eaten it and it's terrible. I threw it in the trash. And just immediately like throat closing, really like a sense of paralysis, feeling like I couldn't like move around to get things that I needed. I remember vividly, there was water on the table in my house, and I was like trying to tell my parents that I needed the water, and they were like, then just grab the water. But I just felt so stuck. And then immediately like vomiting. And it was very terrifying. I remember feeling like the walls were really closing in on me. And so all of those feelings, you know, that's what contributes to that traumatic event. It's that threatened death, that fear, feeling like you're going to die and being in danger. And so that, those symptoms that I were feeling in that moment eventually continued to feel those when my body was actually no longer in danger.
Golly, that must have been horrifying for you. Golly, what a history. So I'm sure after that you were much more attuned, and everybody was attuned to making sure that you stayed away from all the foods that you had been allergic to or diagnosed with allergy to. But then changed, right? You grew up, and tell us about how you came to that next phase when you actually probably went back to your allergist.
Yeah. Yeah. So, I mean, like I said, I was already an anxious kid, and then this happened, and then I was really an anxious kid. I mean, the hypervigilance, like I was double checking everything, so much food that avoid, that I wouldn't eat, because I had had this experience where I had put something in my mouth and I had stopped breathing. And I, as a young kid, didn't trust that that wasn't going to happen again, no matter how much my parents would reassure me or double check. I mean, I couldn't be convinced, and that's what trauma does to you. And so I can't remember it as well, but my parents do back about and kind of reflect on what it was like for me in those like months, specifically after of really having a difficult time. I didn't want to go back to school, and I was a kid that loved going to school. I didn't want to eat anything, and we didn't really have a concept of what that was about at that time, because it wasn't a conversation we were having with our allergist. It was a conversation that was addressed in the room or at the doctor's office, and there wasn't, at least we weren't on any sort of platforms on social media that, you know, other people were having experience. And in my head, and probably in my family's head, I was the only kid in the world that was having this going on for them. And so that in itself was such a challenge, because there wasn't that support system. So I went through a significant amount of my life, I guess, up until I was a junior in high school, going to be a senior in high school, is when I had my second anaphylactic reaction. And my second anaphylactic reaction was a little different. It was cross-contamination. So assuming it was some sort of peanut product, but it was at an ice cream place, so you know it could have been touched by a few different things, but very similar reaction to the allergic reaction afterwards. So feeling like the walls were caving in on me, going to the emergency room, and then being treated the physical symptoms of the anaphylaxis. I was given, you know, steroids when we got there. I was on fluids. We stayed in the ER for a little bit. And then they sent me home, and they were like, you're good. You're not in danger anymore. But my body was still feeling in danger, and it didn't feel like it was not in danger for a really long time. And that, again, is that trauma, those post-traumatic stress symptoms. And it took a little while for me to realize, especially now that I was older, that this is what was going on. So it was at that point that I had gone to get another allergy before I left for college, and to begin my own mental health journey of seeing a therapist for the first time, to sort of work on those things in combination before I left for Ohio State, because I had had amazing parents taking care of me and my brother and our allergies my whole life. But now I'm 18 and I'm moving out of state, and I have to do this on my own. I need fresh numbers, and I need somebody in my support system. So that's kind of how we got there.
Wow, that's just, again, that's just an incredible story. A couple of episodes of anaphylaxis, but now you're progressing on, and you're going into college, and you're going back to the allergist, and I'm assuming that you got some more testing, and that testing probably included the whole allergen testing, as well as the components that led to where you are now, as being liberated from some of your allergies that you were previously diagnosed with. So tell us a little bit about what happened with your testing, and how you came to be liberated from those prior diagnoses.
Yeah, so before I left for Ohio State, I got an allergy test done at my allergist back in Michigan. I grew up in the suburbs of Detroit. And again, we were doing full allergen tests, and I pretty much got the same results. They were saying avoid peanuts, avoid tree nuts, avoid seafood and shellfish, you know, the things that I was used to. So I was like, okay, you know, I'm going off to college with the same list that I've had. No two big changes, but at least I know that that's what's going on. So then I went through 4 years at Ohio State and ended up moving to Chicago to do my master's and my doctorate, and knew that since I was doing the doctorate and it was a long program, that I was going to be here for a while. And I was like, okay, I should probably, you know, get myself checked up again. It's been too long since I've gone and gotten tested. And so I started shopping around for allergists here in the city, and was using the Spoken app to find an allergist that was highly recommended in the area. And so I decided, you know, it was time for me to go. It had been for long. And I shared this story with Susie from Spoken when we did our Allergy Insider live with her on their platform. And I told her, I was like, if I'm being honest, one of the big reasons that I went in to get my allergy testing done again was because I wanted content. I was like, I wanted something to talk about, so that I could make a post about or something. But not going in thinking that like I'm going to come out with this, like my laundry list that's this long is now going to have just one thing. That was never, ever like my expectation. So I, like I said, scheduled my appointment. I was like, okay, I should probably, you know, I could keep pushing this off, but I, one, can get my numbers, and two, I can get some content for my blog, which is so silly, but
No, that's a
um,
great, great.
if I'm being honest, that was a big motivation for it too.
Oh, that's just being honest. I totally understand that. And so you've got some whole allergen and you've got some components done. And you know, I probably should level set all of the audience today on our Allergy Insider program, that what components are. You know, we have done some quizzes and some surveys, and we found out that a lot of folks in the allergy community, they know what whole allergen is, but not all of them know what components are. So let me just level set everybody so we can continue that part of the conversation. That, you know, and to do that, we actually have to talk about how you actually diagnose allergies. So when you're diagnosing an allergy, you always take the history. You know, the history, of course, is what happened to the patient. Did they, when they ate, let's say, a peanut or a tree nut, or they ate something happened to them. And you take all that history, and it includes many areas of how much did you eat, when did you eat it, what else did you do. But you have that history, and then you have the testing. And when you do the testing, you have the whole allergen testing for the blood test as well as the skin prick test. And that whole allergen is just what it sounds like. It's the entire allergen. And you take that information back from what the whole allergen testing was and the history, and you can come up with a diagnosis or consider some further testing after that. Now, the question is, where do components come in for all of that? Well, components are just what they sound like. You take that whole allergen and you break it up into its individual components, its individual pieces, because there's going to be reactions, or there's going to be suspected allergy to a whole allergen, as well as it can be to some of the individual pieces of that whole allergen. And some of those pieces are going to be more concerning than other parts of that whole allergen. Some of them are going to be specific for the item. Let's use peanut as an example. If you do whole allergen testing for peanut, some of those results back will be specific to the peanut, but some will be specific to other kinds of plants that are out there, other kinds of plant species. And the question then becomes, is that whole allergen positivity, whether it's skin prick test or the blood test, is that whole allergen positivity to the specific to that item, like the peanut, or is it to something that's just been shared in the environment, like birch pollen or something else that you could be allergic to? And so that information is all taken back and some decisions are made. And we have components that are available not only to peanuts, but also to the tree nuts, hazelnut, Brazil nut, cashew, and walnut, but also to sesame and wheat. And now we also have some components that are available for cat and dog, or excuse me, for milk and egg, not in the diagnosis of milk and egg, but in the diagnosis of, can they have the baked milk or the baked egg? We also do have them for cat and dog, but that's for a different conversation, not for today. So you have a combination of your whole allergen and these more specific tests, the components, to determine what you should go for whether or not you should go for a food challenge, which is considered the gold standard, or should we just not send you for a food challenge? And I happened to see your results, and when I saw your results back for peanut, the part of the peanut whole allergen that you were that you had sensitivity to, or you had antibodies to, was the were very concerning, and you would not be sent off for that particular one. You are truly allergic to the peanut. But the other ones were allowed your providers, allowed your healthcare providers to make the determination that you could be best sent off for a food challenge and be liberated from that. So that's fantastic. So knowing that information, that history, your physical, your whole allergy, and your components, when you were going for those food challenges, when they were sending you to clear you for those, that must have empowered you to have all that information and maybe give you a little bit more confidence, do you think, to go into those food challenges, or where did you come down on all that? Did that information?
Yeah, 100% gave me more confidence, because I remember I was sitting in the Whole Foods parking lot when I got the phone call from my allergist, and she was reading these results to me, and she was like, yep, like peanuts is definitely still there, reflecting what you were saying, those numbers. But everything else, she's like, there's nothing, it's negative. Like you could go do a food challenge. And I was like, no, No, no. Like it stunned me. I was like, I would absolutely never go do that because I've spent at that point 24 years of my life being absolutely adverse to these things because if I ate them, I was going to go into anaphylaxis. That was my understanding. And I had gone into anaphylaxis twice and it was traumatizing. And I'm going to do absolutely everything I can to stay away from that. And now with a second, you're changing the narrative and saying, no, we want you to come sit and eat 12 of these and we're going to like watch you and see what happens. And so I remember that's great. Like maybe I'm not allergic to these things, but I have no interest in figuring it out further. I'm going to continue to avoid these for the rest of my life. And I was content with that for a while. And then when I established a allergist here in Chicago, I established a new mental health provider here as well. And we would have those conversations. And I went in and I was like, listen, these people are trying to tell me to go eat almonds. And we could process through it together. And she was like, wait a second, like, I think you might be in a place now that, you know, we could move forward with that. And knowing that they were so confident in the peanut because it wasn't just the whole peanut that was lighting up, it was the components of the peanut that were going to be anaphylactic. She was like, yeah, we're not doing anything with that one. That one's staying. But these other ones, like your numbers aren't there. Like we can theoretically do this. And so having that extra data, having that extra information to kind of like back that up made all of the difference for me and all the difference for my family too. They didn't say it to me beforehand, but they were like, we were really nervous to have you go in and do this thing. So when they kind of had that extra data and so they could like fall back on because they spent their whole lives making sure they're stay away from those things too. So it was so empowering to have that information in my back pocket. And don't get me wrong, I went into the challenge. I finally was convinced. I went into the office for the almond food challenge here in Chicago. And I remember sitting in the waiting room and like my stomach was upset. I felt it just didn't feel like it was something that was going to be safe for me to do, even though I was surrounded by all these people that this is their job. This is their livelihood. They know what they're doing. And being able to kind of like fall back and say, okay, like I can look at this piece of paper and I can see these numbers and I can know that this isn't just a guess that they're making. This is really backed up by something else. That I went in there and I choked down the almonds. I did not like how they tasted, but I ate 13 almonds that day. And wow. That was never something I ever thought was going to be possible. And I mean, almond was the first one that I did, but then I ended up challenging a bunch of other ones as well. The majority of the tree nuts, I think the only one I have left to do is maybe macadamia nuts. And then a lot of shellfish and finfish as well. And being able to take so many of those things off of my laundry list. And now my friends always laugh when we go to a restaurant and they'll say, you know, do you have any allergies? And I used to sit there and like, you know, like count them off. And I say, just peanuts. And I think that is one of the places that I've really seen such a big change for myself. Not only is there all these different places I could go, but the kind of, I guess the safety I feel being able to kind of narrow that down a little bit is so valuable. So,
yeah, well, you know, and I should mention real quick that, you know, I know you used the whole allergen testing and the component testing to help, you know, empower you like you're describing to liberate you from these food allergies. But I'm sure your providers being able to recommend, your healthcare providers recommending those food challenges when they get those results back, that really empowers them too, because you know most providers want to liberate the patients who are not truly allergic and may have just had some testing in the past, did not have this more advanced component testing, which really helps us out a lot. So I'm sure it helped them too. So you know we're coming up on almost 30 minutes here, so we only got a few more minutes before we end the program. But so you know, tell the audience that how are you using the information and all the history that you have, whether when you were a child and your transition out of that to your adulthood to where you are now, using all that and using all of the knowledge that you have that you're gaining right now in the healthcare space or the mental health space. How are you using that? What are your plans to go ahead and execute that on your future, on your different, not just your future, but also on your different platforms?
Yeah, absolutely. I think that, you know, I had shared earlier that when I was in first grade, that me and my family felt like we were the only people going through this. And I don't want anybody to feel like that is their experience, because it's not true. Um, I started All Things Allergies, my blog, back, I guess it was 2019. I continue to be astounded by how many people reach out to me and say that they have had a similar experience with post-traumatic stress symptoms, you know, after anaphylaxis, and that it's so empowering to have that community of people to know that we're not the only people, you know, going through this, and that there are interventions and help that we can get. So I started All Things Allergies largely for that reason, to be a mental health advocate, and I'm pursuing doctorate in clinical psychology, and I'm hoping to do my dissertation in this direction as well, and look at the intersectionality between mental health and food allergies, specifically the similarities between the physiological and the psychological, those symptoms between anaphylaxis and anxiety. A panic attack really mimics anaphylaxis, and how do we differentiate those things? So that's the direction that I want to go, and really utilizing my mental health background to kind of do these food challenges as well. I have a blog post that can kind of shout some of those out as well on my blog. I have it's called the Exposure Therapy: Conquering Food Challenges After Years of Food Anxiety. It kind of goes through this story a little bit that we've been talking about, but it gets into this hierarchy idea of how I went about the food challenges, you know, having that insider information in my back pocket about the components versus the whole allergens, and being able to take an approach to the food challenges that was going to feel more digestible for me. I guess no pun intended, but that it was going to be less scary, that I had, you know, lived through all of this in the past, and this was not something I was looking forward to doing, but how can I use that information to go about this step by step in a way that's going to make me feel safe and comfortable. So definitely have a lot of resources on my website. I have a whole mental health page with links to different articles that has my journey on there, and some of the blog posts, as well as the hierarchy to approaching food challenges, that I hope other people can take that and know that they are not the only people in this world managing that.
Oh, that's just great. It really is. You're able to take what you've done in the past and all of your history, and you're able to take that, couple it together with what you're studying now, and for the future, you're just going to be a great advocate and a great educator when it comes to not just the food space, like I said, but also the mental health space. That's fantastic. That is great. So we're just about out of time. So beginning of our program that we have to wait to the end, because we have a giveaway, an Instagram giveaway, and I think we're going to let the future Dr. Bauder tell us about the Instagram giveaway. Dr. Bauder.
I love it. I love it. So I had mentioned earlier that it was a few weeks back, I had done an Instagram live with Susie from Spoken, who Allergy Insider is partnered with. And we were talking about some of these similar ideas in a similar story that I shared here today. But in continuation of the collaboration between Allergy Insider and Spoken, Spoken and Allergy Insider are going to be giving away 2 tickets to the upcoming gingerbread house decorating event, which I'm so excited about. When Susie told me about it, I was like, this is my dream come true. I do a gingerbread house every year around the holidays. And so if you head over to, it's linked on Spoken, it's also linked on Allergy Insider's Instagram. You have to follow both accounts. You got to make sure that you like it and comment, and you'll be entered to win for the top 9 allergen-free gingerbread house giveaway. It's here in Chicago. I'm going to be there. I'm so excited. And there's going to be like a gluten-free hot chocolate bar. There's going to be like swag that we get away, and it's going to be allergy friendly, and it's going to be safe, and it's going to feel inclusive for everybody that's there and has some of these similar allergies to we do. So I'm so excited. Make sure that you enter. It closes on Monday night, so make sure that you go in and tag your friends in it and let everybody know. It's going to be Sunday, December 4th, and it's going to be like a 2-hour event here in Chicago, and I would love to see everybody there. So make sure that you enter, and best of luck.
All right. Thank you so much, Alyssa. Thank you. I mean, really, your story is inspirational. I know a lot of the folks in the allergy community that are watching this right now, whether they're parents or patients themselves, I'm sure they're watching this saying, wow, this, if you know, their situation could be very similar to your situation. And if they've not had these component testing done to determine, is it just some cross reactivity or is it the real, I'm sure they're going to be able to take this information back and take it to their healthcare providers and maybe, you know, talk about what their future holds for them too. So it's an inspirational story and I can't thank you enough. And with that, I think we're just about at the end. I'm going to check the chat real quick, make sure we don't have any questions. I don't see any questions in the chat. So I'm assuming there's no good questions right now. So it looks like we must have covered everything about your components so thoroughly that we don't have any questions, which is a good thing. So all that so much. Thank you for joining us today and taking time out of your busy day as a grad student up there. And I'm sure folks can use this information for their future. And with that, I'll bid everybody a farewell. Bye,
Thanks
everybody.
so much.